Hello everyone. In today's video, we'll discuss the hip bone, one of the most important bones of the appendicular skeleton. The hip bone is formed by the fusion of three bones, the ilium, the ischium, and the pubis. These three bones fuse together at the acetabulum, which forms the socket for the head of the femur, creating the hip joint. First, let's focus on the ilium. The ilium is the largest and uppermost part of the hip bone. It forms the upper 2/5 of the acetabulum. The ilium has an upper expanded end, known as the iliac crest, a lower end, which joins the pubis and ischium at the acetabulum. The iliac crest is a broad convex ridge. Its highest point lies slightly behind the midpoint of the crest. The anterior end of the iliac crest forms the anterior superior iliac spine, while the posterior end forms the posterior superior iliac spine. From the anterior superior iliac spine, the anterior border descends toward the acetabulum. On the posterior border, another prominent projection, the posterior inferior iliac spine, lies just below the posterior superior iliac spine. Further down, the posterior border is interrupted by the greater sciatic notch, an important landmark through which several nerves and vessels pass. The medial border extends from the iliac crest to the iliopubic eminence, and its lower rounded part contributes to the arcuate line, which forms part of the pelvic inlet. The iliac surface contributes to the lateral wall of the false pelvis. The gluteal surface is the outer surface of the ilium and is divided by the posterior, anterior, and inferior gluteal lines, which serve as attachment sites for the gluteal muscles. Finally, the sacropelvic surface is divided into three regions: the iliac tuberosity, the auricular surface for articulation with the sacrum, and the pelvic surface. Next is the pubis, which forms the anterior 1/5 of the acetabulum and the anterior boundary of the obturator foramen. The pubis consists of a body, a superior ramus, and an inferior ramus. The body has a superior border called the pubic crest, and at its lateral end lies the pubic tubercle, an important attachment site for the inguinal ligament. The superior ramus extends from the body to the acetabulum. It has superior, anterior, and inferior borders. The superior border forms the pectineal line, also called the pecten pubis, while the anterior border forms the obturator crest. The sharp inferior border contributes to the upper margin of the obturator foramen. The inferior ramus extends downward to join the ramus of the ischium, forming the conjoined ischiopubic ramus. The third component is the ischium, which forms the posterior 2/5 of the acetabulum and the posterior boundary of the obturator foramen. The ischium consists of a body and a ramus. The body lies below and behind the acetabulum. The lower end expands to form the ischial tuberosity, the strong weight-bearing prominence that supports the body while sitting and provides attachment for the hamstring muscles. The posterior border contributes to the lower border of the greater sciatic notch. Just below this notch is the ischial spine, another important anatomical landmark. Below the ischial spine lies the lesser sciatic notch. Finally, let's briefly discuss two important features of the hip bone. The acetabulum is a deep, cup-shaped hemispherical cavity located on the lateral aspect of the hip bone. It articulates with the head of the femur to form the hip joint. The inferior deficient portion of the acetabulum is called the acetabular notch. The obturator foramen is the large opening located antero-inferior to the acetabulum, between the pubis and the ischium. It is largely covered by the obturator membrane, leaving only the obturator canal for the passage of neurovascular structures.